Edutainment Studios welcomes you to Osteoporosis, Bone Weakness. This module is part 1 of a 4-part series on osteoporosis. Osteoporosis is a disease that weakens bones to the point where they break easily. Most often, these are the bones in the hip, backbone or spine, and wrist. With osteoporosis, you may not notice any changes until a bone breaks. In actuality, your bones have been losing strength for many years. Bone is living tissue. To keep bones strong, your body breaks down old bone and replaces it with new bone tissue. Sometime around the age 30, bone mass stops increasing. Therefore, the goal for bone health is to keep as much as possible, for as long as possible. As people enter their 40s and 50s, more bone may be broken down than is replaced. In this course, the objective is to help you learn what osteoporosis is, who is at risk of getting it, what causes it, if and how your bones can be tested. Although osteoporosis can strike at any age and any gender, it is most common among older women. White and Asian women are most likely to have osteoporosis. Other women at greater risk include those who have a family history of broken bones or osteoporosis, have broken a bone after the age of 50, had surgery to remove their ovaries before their period stopped, had early menopause, have not acquired enough calcium and/or vitamin D throughout their lives, had extended bed rest or were physically inactive, smoke, as this causes less calcium to be absorbed from their diets, take certain medications, including medicines for arthritis, asthma, and some cancer drugs, use certain medicines for a long time, have a small body frame. The risk of osteoporosis grows as a person gets older. At the time of menopause, there is a several-year time span where women may lose bone quickly. After that, the loss slows down, but it does continue. In men, the loss of bone mass is slower, but by age 65 or 70, men and women are losing bone at the same rate. Osteoporosis is not just a women's disease. Not as many men have it as women do, possibly due to the fact that most men start with more bone density. As they age, men lose bone density more slowly than women, but they should still be made aware of osteoporosis. Experts do not know as much about this disease in men as they do in women. However, many of the things that put men at risk are the same as those for women, including family history, not having enough calcium or vitamin D, too little exercise, low levels of testosterone, too much alcohol, taking certain drugs, and smoking. Older men who break a bone easily or are at risk for osteoporosis should talk with their doctors about testing and treatment. Your doctor may call it osteopenia, or low bone mass. You should consider this as a warning. It means that bone loss has started, but it is not too late to take action to keep your bones strong, while possibly even preventing osteoporosis later in life. If preventative measures are taken, you will be less likely to break a wrist, hip, or vertebrae when you are older. Osteopenia is a bone condition characterized by a decreased density of the bone, which leads to bone weakening and increased risk of breaking a bone or sustaining a fracture. Osteopenia and osteoporosis are related conditions. The difference between the two is that in osteopenia, the bone loss is not as severe as it is in osteoporosis. This means that someone with osteopenia is more likely to fracture a bone than someone with a normal bone density, but is less likely to fracture a bone than someone with osteoporosis. For some people, the first sign of osteoporosis is realizing that they are getting shorter, or their bones break easily. It is not a good idea to wait until this happens before testing for osteoporosis. You can have a bone density test to find out how strong your bones are. It is recommended that women age 65 and older be screened or tested for osteoporosis, as well as women under age 65 who are at increased risk for an osteoporosis-related fracture. A bone density test determines if you have osteoporosis. This is a disorder characterized by bones that are more fragile and more likely to break. In the past, osteoporosis would be suspected only after someone broke a bone. By that time, however, their bones could be quite weak. A bone density test enhances the accuracy of calculating your risk of breaking bones. A bone density test uses X-rays to measure how many grams of calcium and other bone minerals are packed into a segment of bone. The bones that are most commonly tested are in the spine, hip, and sometimes the forearm. Doctors use bone density testing to identify decreases in bone density before a bone breaks. Determine your risk of broken bones or fractures. Confirm a diagnosis of osteoporosis. Monitor osteoporosis treatment. The higher your bone mineral content, the denser your bones are. And the denser your bones, the stronger they generally are and less likely they are to break. Bone density tests differ from bone scans. Bone scans require an injection beforehand and are usually used to detect fractures, cancer, infections, and other abnormalities in the bone. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 1 of 4 on osteoporosis, and please join us for Part 2.